TB is an infectious disease caused by bacteria that most often affects the lungs. Although it's preventable and curable, about a quarter of the global population estimated to have been infected with TB bacteria. The risk of a TB infection becoming active with increasing of age. Until children reach age of 5, they have high risk of a TB infection becoming an active TB disease. The risk is greater for children under age of 2. Tuberculosis in this age group often leads to serious disease in the fluid surrounding the brain and the spinal column, called meningitis, which is an inflammation on the lining of the brain. People in the age group of 15 to 25 have an increased risk of developing more severe active TB disease in the lungs. The immune system weakens during older age. Older adults have a greater risk of active TB disease. Also, the disease may be difficult to treat. In the 3 years when COVID-19 became the world's leading cause of death from 2019 to 2022, TB has returned to replace in the following years. In 2023, a total of 10.8 million people fell ill with TB worldwide. With that number, an astonishing 1.25 million people died in the same year. In the same year in Malaysia, it's unfortunate that TB cases has been increasing by 5.47% to 26,781 from 25,391 in 2022. The rate of infection of TB in Malaysia is said to be 122 out of 100,000 persons in Malaysia. Government should focus on states like Sabah, Selangor and Sarawak as the states have higher average cases per year, while Labuan, Perlis and Malacca have the lowest.
Now, let's move on to the chronology of tuberculosis disease, also known as TB. TB has been a major health issue in Malaysia for decades. In the early of 20th century, it was a leading cause of death due to poor living condition. In 1961, Malaysia launched the National TB Control Program, introducing the vaccine BCG to protect children. The 1980s and 1990s saw the resurgence of TB due to HIV and AIDS. This prompted Malaysia to strengthen its effort, including the Directly Observed Therapy program, also known as DOT. Today, Malaysia continues to fight TB with better diagnostic treatments, access, and public health campaigns, though challenges like drug-resistant TB and migrant population remain.
TB infection may be one of 3 stages. First of all, primary stage. In this stage, immune system cells will capture the germs, but some may still survive or even multiply. Some people may get flu-like symptoms such as low fever, tiredness, and coughing. The secondly, latent stage. In this stage, our immune system will build a wall around lungs tissue with TB germs. The immune system just keep them under control, but they still survive. So, no symptoms during this stage. Last one is active TB stage. This happens when the immune system can't control the infection. This stage may happen right after primary stage, but it usually happens after a month or year of facing latent stage. So, the symptoms is like coughing, up blood, chest pain, night sweat, and not wanting to eat. This stage also may happen outside the lung, such as kidney, genitals, liver, and heart muscles. It is also called as extrapulmonary tuberculosis. These symptoms that I have mentioned occur on teenagers and adults only. For 1 to 12 years old, they may have long fever and weight loss. For infants, the baby doesn't gain weight or may have symptoms such as poor reflexes, vomiting, and having bulging spot on the head. So, get an emergency care if you have these symptoms and see the doctor.
So, what is tuberculosis? Tuberculosis, or in short term known as TB, is caused by a bacterium called Mycobacterium tuberculosis. Most people think that TB only affects the lungs, and yes, pulmonary TB is the most common type. But TB can also affect other parts of the body like the brain, spine, or kidneys. We call that as extrapulmonary TB. So how does TB spread? TB spreads through the air. If someone with active TB in their lungs or voice box coughs, sneezes, talks, laughs, or sings, they release tiny droplets filled with TB bacteria. And if you breathe in those droplets, you could get infected. And once inside the lungs, the bacteria can travel through the bloodstream to other organs. So where does TB spread more easily? Usually, TB is more likely to spread in places where people are close together for a long time, especially in indoor spaces with poor ventilation, like small rooms or vehicles. It also spreads easily in crowded gatherings, workplace, or homes, where people live closely. So it's very important to think that air circulation and personal space in such settings are controlled. Now, not everyone who breathes in TB bacteria gets sick right away. Some people can fight off the bacteria and it stays inactive in their body. This is called as latent TB. So if you have latent TB, you won't feel sick, you won't have symptoms, and you cannot spread the disease to others. But here's the catch. If your immune system gets weak later on, those bacteria can wake up and cause active TB disease. In fact, 1 out of 10 people with latent TB will develop active TB at some point if they don't get treated. On the other hand, active TB means the bacteria are multiplying and making you sick. People with active TB in the lungs can spread the disease to the others. There's also something called biliary TB. Biliary TB is a severe form where the bacteria spread throughout the body. This can lead to serious problems like meningitis, hepatitis, and scrofula, which will affect the lymph nodes over time. So how long is TB contagious? So if someone starts proper treatment for active TB, they usually stop being contagious after about 2 to 3 weeks. And remember, people with latent TB are not contagious at all. Now that we know how TB spreads, let's take a closer look at the symptoms of tuberculosis and how to recognize if someone might be infected.
When an individual is infected with tuberculosis, medication is initially used to gradually suppress this bacterial infection. A 6-month treatment regimen is conducted to monitor the patient condition with different medications. Initially, a combination of oral antibiotics are used to treat the patient, which are isoniazid, rifampin, pyrazinamide, and ethambutol. In case tuberculosis are resistant against these drugs, doctors might prescribe the patient alternative drugs like kanamycin and amikacin to test whether these drugs are effective. However, if medication cannot suppress the infection during the treatment regimen, doctors may recommend the patient to have surgical resection to remove part of the infected lung to treat the infection.
As we all know, prevention is better than cure. With that being said, here are the list of precautions that we can take to protect ourselves against tuberculosis. The first method is to get vaccinated, which is a BCG vaccine. The BCG vaccine is given to infants in high-risk areas, but it doesn't completely prevent TB, but it helps to protect against severe forms of disease like TB meningitis. The second method is to wear a mask and maintain our hygiene. TB usually spreads through the air when an infected person coughs, sneezes, or even talks. Wearing an N95 mask in crowded place reduces your risk. Always cover your mouth and don't forget to always wash your hands regularly to prevent infection. The third one is ensure good ventilation. TB bacteria can remain in the air for hours, especially in the closed spaces. Keep rooms well ventilated by opening windows and using fans to improve airflow and reduce the spread of bacteria. The fourth one, avoid close contact with TB patients. If someone have active TB, maintain a safe distance and avoid sharing personal items such as utensils and towels. Encourage them to seek for medical treatment and follow isolation guidelines to prevent spreading the disease. The fifth one is to make sure get tested and complete treatment. If you have symptoms like a persistent cough, fever, or night sweats, make sure to get tested for TB immediately. If diagnosed, complete the full course of treatment, which is 6 to 9 months to avoid drug-resistant TB, which is harder to treat. The last one is strengthen your immune system. A strong immune system helps to protect us against infection. Don't forget to eat nutritious food rich in vitamin A, C, D, exercise regularly, and get enough sleep. Avoid smoking and alcohol as they weaken the lung function and increase the TB risk. Taking these precautions can help to stop the spread of TB and can keep you feel healthy. So don't forget, stay safe and protect yourself.
So to wrap up, tuberculosis is a serious but preventable and treatable disease. By understanding how it spreads, the difference between latent and active TB, and the dangers of drug-resistant TB, we can protect ourselves and others. Thank you for watching. Give us a like, subscribe, and share this video to others. And hope you have a great day. Thank you so much.